alaikum friends. Hope so you are all doing well. Welcome back to another topic on my YouTube channel. In this video we are discussing about the body organ lungs. What are lungs? The lungs are the organs of respiration. They located in the thorax either side of the mediastinum. The function of the lungs is to oxygenate blood. They achieve this by bringing inspired air into close contact with oxygen poor blood in the pulmonary capillaries. In this article, we should look at the anatomy of the lungs, their anatomical relations, neurovascular supply, and clinical correlations. You can see the picture of the lungs. No, we are discussing anatomical positions and relations. The lungs lie either side of the mediastinum within the thoracic cavity. Each lung is surrounded by a pleural cavity which is formed by visceral and parietal pleura. They are suspended from the mediastinum by the lung root, a collection of structures entering and leaving the lungs. The medial surfaces of both lungs lie in close proximity to several mediastinal structures. You can see in the picture left lung and right lung. Left lung, heart, arc of aorta, thoracic aorta, and esophagus. Right lung, esophagus, heart, inferior vena cava, superior vena cava, and azygous vein. Next, we are discussing lung structure. The lungs are roughly cone shaped with an apex base, 3 surfaces and 3 borders. The left lung is slightly smaller than the right. This is due to the presence of heart. Each lung consists of apex, base, lobe, surfaces, and borders. First of all, we discuss apex. What is apex? The blunt superior end of the lung. It projects upward above the level of the first tip and into the floor of the neck. Next, base, the inferior surface of the lung which sits on the diaphragm. Lobes, 2 or 3 lobes. These are separated by fissures with the lung. Surfaces, 3 surfaces. These correspond to the area of the thorax that they face. They are named costal, mediastinal, and diaphragmatic borders. The edges of the lungs name the anterior, inferior, and posterior borders. Next, we can discuss the lobes of the lungs. The right and left lungs do not have an identical lobular structure. The right lung has 3 lobes: superior, middle, and inferior. The lobes are divided from each other by 2 fissures. Oblique fissure runs from the inferior border of the lung in a supra-posterior direction until it meets the posterior lung border. Horizontal fissure runs horizontally from the sternum at the level of the fourth rib to meet the oblique fissure. The left lung contains superior and inferior lobes which are separated by a similar oblique fissure. You can see in this picture left and right lung. Left lung has helium, oblique fissure, and right lung has horizontal fissure. Next, you can see the surfaces of lungs. There are 3 lung surfaces, each corresponding to an area of the thorax. The mediastinal surface of the lung faces the lateral aspect of the middle mediastinum. The lung hilum, where structure enters and leaves the lung, is located on this surface. The base of the lung is formed by the diaphragmatic surface. It rests on the dome of the diaphragm and has a concave shape. This concavity is deeper in the right lung due to the higher position of the right dome overlying the lumen. The costal surface is smooth and convex. It faces the internal surface of the chest wall. It is related to the costal pleura which separates it from the ribs and innermost intercostal muscle borders. In borders, the anterior border of the lung is formed by the convergence of the mediastinal and costal surfaces. On the left lung, the anterior border is marked by a deep notch created by the apex of the heart. It is known as cardiac notch. The inferior border separates the base of the lung from the costal and mediastinal surfaces. The posterior border is smooth and rounded in contrast to the anterior and inferior borders, which are sharp. It is formed by the costal and mediastinal surfaces meeting posteriorly. Root and hilum. The lung root is a collection of structures that suspends the lung from the mediastinum. Each root contains a bronchus, pulmonary artery, two pulmonary veins, bronchial vessels, pulmonary plexus of nerves, and lymphatic vessels. All these structures enter or leave the lung via the hilum, a wedge-shaped area on its mediastinal surface. You can see in this diagram pleural cavity, lung hilum, and visceral pleura. This is all about this video on lungs. Inshallah, we can meet in the next video. Kindly, I have one request to all my friends to subscribe and like my video, subscribe my channel. Thank you so much.